Diolch Llywydd. First Minister, can you tell us which areas of Wales have the highest rates of late-stage cancer diagnosis?
Well, I mean, that's something that I would have to write to the member about, but we do know that as far as the targets are concerned, in Wales our figures compare very well.
Rich or poor, rural or urban, man or woman, cancer is an indiscriminate disease, yet diagnosis is anything but. Recent research by Macmillan shows that cancer diagnosis in this country remains a postcode lottery, and our poorest communities consistently face later stage diagnosis. Where stage is recorded, more than 1 in 4 people in Wales were diagnosed with cancer at its latest stage, which is stage 4. This is not only unacceptable in the context of our rates being the worst of any country in the UK, it's not acceptable full stop. For some cancers, the wait between first suspecting that something is wrong and diagnosis is the longest in Europe. We all know that catching cancer early saves lives. First Minister, you can save lives. Will you commit to setting and sticking to a 28-day cancer diagnosis target for all so that we can catch cancer early?
Well, what medics tell me is that it can't be done for all types of cancer, that sometimes it takes longer for certain cancers to be diagnosed. Now, she makes the point that it's hugely important, for example, for people to be encouraged to present early, and also, of course, for GPs to refer people early on in the pathway. We know the vast majority of cancer patients in Wales start their treatment within target times. We know that the incidence of cancer continues to rise and treatment is increasing in complexity. The number of referrals for suspected cancer requiring investigation has risen by more than 36,000 over a 5-year period to around 96,000 referrals a year, which I think is at least partial good news, because it means people are being referred on more quickly. We know, of course, that 85.5% of patients newly diagnosed with cancer via the urgent suspected cancer route started definitive treatment within the target time of 62 days, and 97% of those diagnosed not via the urgent route started definitive treatment within a target time of 31 days.
So you're talking about treatment, and I'm asking you about diagnosis. Cancer Research UK has championed it, clinicians are calling for it, England is doing it, and yet, First Minister, you continue to argue with the experts. You reject 28-day targets, not for the good of patients, but for the good of your own public relations. You won't hit those targets, and you won't meet those patients' needs. First Minister, the evidence is clear. People in poorer areas are diagnosed later. Macmillan's data shows stage 4 diagnosis in our poorest areas is up to 9% higher compared to their wealthier neighbours. You can't afford to be poor and ill in Labour's Wales. An information campaign, more readily access to GPs and diagnosis services could turn this around. So will you commit to creating accessible cancer diagnosis services in all parts of Wales so that whether you are rich or poor, your cancer diagnosis is not left too late?
Well, I mean, as somebody who is married to somebody who works for Macmillan, I'm lobbied on a daily basis in terms of the way cancer is dealt with in Wales. And I can say there is no clinical evidence at all to suggest that a 28-day target would work. Where's that come from? Where is the clinical evidence to say that 28 days is some kind of golden figure? Politicians love these figures, but in reality, I don't see any clinical evidence for it. There are the issues. Well, there's no point shouting. If you ask the question, I'll answer the question for you now. Part of the problem is a reluctance in some areas for people to come forward early, and that doesn't help. We need to make sure that all GPs are referring as quickly as possible, because access to treatment is the same for everyone. It's simply a question of encouraging people to come forward as early as possible and for GPs to refer as quickly as possible. And that is something that is hugely important in terms of the campaigns that we have run, in terms of raising awareness of different types of cancer, because we know if people are asked to check their symptoms, they are more likely to present early. And that's the way to make sure that more people, not just are cured of cancer, but they live with cancer, making sure that people are aware of the different types of cancers and their symptoms. And the work that Macmillan does is exactly that. Part of their work is to raise awareness of different cancers, provide evidence to people. They will be at the Royal Welsh Show. One of the themes they've had at the Royal Welsh Show is they have dealt with skin cancer, melanoma especially, with the show that's held in the summer, and they focus very, very strongly on people identifying cancer at an early stage themselves, or what may be the symptoms of cancer, so they can present, so then of course they can have a better outcome.